Nella Yalwa, who joins us now from Johannesburg. Nella, very good morning to you. What sort of impact are these cuts likely to have?
Good morning to you and the viewers at home. These cuts will mean that many people, more especially the public healthcare users, the poorest of the poor, people living with HIV, people living with TB and other chronic illnesses, it means that they will suffer more. We have seen this during the lockdown, where people live with HIV, TB and other chronic illnesses were not provided with any services in our clinics, where people were told that the priority is COVID-19. As the results of that, as we are talking now, we've got a lot of people who are lost on follow-up and people who have defaulted on treatment. And the question that we do not understand, why our government is prioritizing one illness over the other. Because if we are to look in South Africa, we've got many people who are living with HIV, people who are living with TB, and if our government is going to cut the budget allocation about 50 billion and so forth, the other worry that we are having is to say, as the country, we've got conditional grant on HIV and TB response. And the question we're asking ourselves, why is that money now being reprioritized? We see that there are a lot of other services that are included under that grant. And in June, you will recall that the Minister of Finance, during the midterm budget speech that he had around June last year, about 600 million rands was taken from the conditional grant, and that money was allocated to a response to COVID-19, meaning that services that were meant for HIV and TB were not provided. And that's what we have seen on the ground. So this is worrisome to us.
I mean, it's mind-boggling, isn't it? Especially when you know where the money's going to SOEs that'll never get off the ground. What are you going to do now that this budget has been cut and you left in the state? What happens next?
What happens next is for us to go on the ground, to mobilize the people on the ground, public healthcare users, the partners that we are working with, so that firstly, we monitor the provision of services, whether there is a change from service provision from now previous and compare it with previously. But on top of that, what worries us is that as much as our government has cut the budget, we know that COVID-19 came with a lot of disruptions. And as the result of that, many healthcare workers have succumbed to COVID-19. And in many provinces, we know that we've got vacant posts that are not filled. So the question that we're asking ourselves, what will happen about those vacant posts that were existing before and those that are created by the number of healthcare workers who have succumbed? We know the state of our clinics in terms of infrastructure. They are, in majority of them are bad, and we are asking ourselves what is going to happen in terms of renovation of our clinics and all what have you if this money is going to be reduced. And on top of that, we have been experiencing a shortage of medicines and medicine stockouts due to a number of reasons. The question we're asking ourselves, what is going to happen in terms of ensuring that those services are provided to the people and no one is left out? But on top of that, the only thing our government is not prepared to do is to show us the action they have taken about people who have looted billions and billions of rands from the Department of Health. We know the stories of Brian Shongwan Gauteng, who looted billions of rands. We know what the former MEC of Health in Eastern Cape, MEC Gomba, where she took the money to buy scooters unnecessary. So there is just a lot of corruption which is happening within the Department of Health, and we don't know how is the department going to recoup that money in order for that money to be injected back for service provision.
Nella Yalwa, good to talk to you. Thank you.